Hello and welcome to World Parkinson's Program live Q&A session. We have been taking more breaks, trying to figure out how it can work technically. Everything can go okay. So hopefully some people can see us and join us. So I was speaking about. I was speaking about various aspects of Parkinson's disease. As you might have heard, World Parkinson's Program is a Canadian-based charitable and non-profit organization which helps patients to get educational literature in their languages, and it is the organization or the only organization which provides medications as well as walking aids to patients who are affected with Parkinson's disease and they are not able to afford these healthcare necessities. So World Parkinson Program was started in 2008 and it has chapters in several countries, and this is a new effort to reach Parkinson's patients using social media to see if they have any questions or if they want to have some discussion about some points or learn more about Parkinson's disease. So we have started this program that on Sundays for about half an hour we'll be meeting people. We have someone who just joined and they are asking what tests are used to diagnose Parkinson's. Unfortunately for Parkinson's disease, there are no tests which can confirm the diagnosis of Parkinson's. Like many other conditions, people have a blood test or an MRI test. So they take that test and that test confirms that they have this disease. But in case of Parkinson's disease, there is no test which can be done to confirm the presence of Parkinson's disease. So the diagnosis is mostly done by the history and physical examination by the physician. So there is a detailed assessment which takes place first time. The physician goes through a lot of questions for patients and reviews their other aspects of history, past medical history, medications, family history, and then they examine the patient. There are certain parts of examination which are carried out by the physician to reach a diagnosis of Parkinson's disease. Sometimes if the symptoms are subtle, the physician may need to see you again to make sure that they are certain about the diagnosis, or sometimes there could be conditions which may mimic Parkinson's disease, and in those cases physician may need to see you for some time on continuous basis, and then they can decide whether the diagnosis is Parkinson's disease. So another question came from somewhere about how do you start the treatment of Parkinson's disease? The treatment of Parkinson's disease is started when a person is diagnosed with Parkinson's disease on the first visit. So we had some discussion about this point before. Usually treatment is not delayed. When patients are diagnosed with Parkinson's disease, treatment is initiated. The initiation of treatment depends on many factors. First, there are many different types of treatments, such as medications, and there are some adjunctive treatments, such as physiotherapy, speech therapy, and in some cases, brain surgery may be required. The decision to start which medication should be started first is based on many factors, such as age of patient, the stage of the disease, as well as the symptoms with which the patient is affected with. So all these things are taken into consideration, and then the selection of the most appropriate drug is done, which is initiated to the patient. There's a detailed discussion which takes place about the expectation of the treatment, the prognosis, and other instructions how to take these medications. As time goes by, the medications may need to be changed or adjusted to have the best efficacy, and also sometimes certain medications could cause undesired effects, and therefore we might need to change medication or adjust their dosage. So another question we have is someone is asking what can be done for drooling. Drooling is not uncommon in Parkinson's disease, especially in the late stages of Parkinson's disease. I'll give you a little bit of background on drooling. Drooling initially could be just at night time, and patients may notice a slight drool of saliva on one side of mouth, the side they are sleeping on, and at night time, in the daytime, they may be fine, and slowly they might notice some drooling in the daytime as well. Drooling is due to decreased swallowing of their own saliva. So there are many different treatments which can help drooling. First, we educate patients about certain strategies without the medications which can help, such as reminding themselves to swallow more frequently. So if they swallow more frequently their own saliva, then the saliva would not pool in the front part of mouth and would not, and they would not experience drooling. Keeping their head posture straight. Certain patients have their head posture which is bent forward. Their head is bent forward, which also leads to pooling of the saliva, and then this saliva dribbles time to time. So if they can keep their head posture straight and remind themselves to swallow more frequently, this could help. Certain reports have also shown that chewing gum might help. Other people think that chewing gum produces more saliva. So, however, subjectively, some patients have felt that chewing gum does help the issue of drooling. Probably it helps to retain their swallowing reflex, the spontaneous swallowing reflex, which is decreased in Parkinson's disease. So probably it helps to maintain it, and therefore these patients don't experience drooling. Other than these things, there are certain other medications which can help, such as dopaminergic medications. The medications used for Parkinson's disease, levodopa or dopamine agonist, when they are started, so patients might notice that the drooling has improved. So as the dose of medication is adjusted, it leads to further improvement of drooling. Other than this, if they still experience drooling, certain things can be done, such as medication like amitriptyline. A low dose amitriptyline might cause dry mouth as a side effect, which can help to cope with drooling. Trihexyphenidyl is another medication which has also side effect of dry mouth, and it can help with drooling. However, these medications should be started with a caution in elderly, as they could cause some other undesirable side effects. Other than this, a scopolamine patch, it is a patch which can be applied behind the ear, usually applied behind the ear, and it can lead to dryness of mouth, and it can help with drooling. Some people use this for motion sickness when they go on a cruise or so. And other than this, atropine drops, these are eye drops which could be used in mouth as needed basis. They can also help with drying the mouth out, and botulinum toxin is an other agent which can help This is a toxin which is derived from the bacteria, and those bacteria which cause food poisoning. So it's a purified form of toxin. It stays locally. It's injected into the glands which produce saliva in the saliva, and these injections are required usually every 3 to 4 months. So they can lead to improvement in drooling as well. We have another question. What is the main symptom of Parkinson's? Parkinson's disease has both motor and non-motor symptoms. The diagnosis of Parkinson's disease rests on the motor symptoms of Parkinson's disease, as we were mentioning earlier, that slowness of movements or bradykinesia, arresting tremor, stiffness of the muscles, and as well as balance problems. So these are main motor symptoms of Parkinson's disease. So the most common symptom usually is considered bradykinesia, which is the most important and cardinal symptom of Parkinson's disease, the slowness of movement. The slowness of movement or bradykinesia is experienced by patients. Patients notice that they have certain difficulty in completing their tasks in a timely fashion. They become slow. They start taking a longer time to finish their meals, dressing, or doing other household chores. And if sometime the patient goes out for a walk for a spouse, they might start noticing that they can't keep up with the speed of walking, and they have become overly slow, and they are left behind. The other spouse has to wait, so they sometimes let it go for some days, and they decide to seek medical attention. So slowness of movements or bradykinesia is one of the commonest symptom of Parkinson's disease, and sometimes it could be subtle. It may affect only writing, causing small size handwriting, or trouble with fine motor tasks such as fastening the buttons, putting on socks, or putting on makeup, or trimming. So these things have to be assessed very carefully to bring out this symptom during the assessment. The slowness of movements is a disabling symptom, and it does progress as the disease progresses, and eventually patients have difficulty completing their activities of daily life. Another question we have is, can Parkinson's disease be prevented? That's a very interesting question. The prevention of Parkinson's disease, it's a long discussion. First of all, there are some protective factors such as smoking and caffeine, coffee. So caffeine intake and smoking are regarded as the protective factors for Parkinson's disease. So, however, so it means that the people who smoke, in simple terms, people who smoke as compared to those who don't smoke, they are at a lesser of a risk of developing Parkinson's disease. So, however, because smoking has so many other effects on cardiovascular health and lungs, and is associated with so much morbidity and mortality, that it can't be regarded as a protective to smoke for Parkinson's disease. The other things is some of the natural toxins which have been associated with some higher risk for Parkinson's, such as pesticides. So protections using these elements during work or during the agriculture work would probably be very helpful. Otherwise, to protect those neurons which start degenerating in brain, we don't have a definite neuroprotective agent at this point. Someone is asking, how can one better cope with having Parkinson's disease? I think it's a teamwork. It's a patient, care partner, and physician, and other people in the healthcare team, such as physiotherapist, speech and swallowing therapist, and a personal trainer. So it's a teamwork. One can cope with Parkinson's disease if they are very much involved in their treatment. That's the first. That is one of the first conditions, that the patient must be involved in the treatment. They should be active. They should be seeking more knowledge about their condition. As I always say, those who fight Parkinson's always find solutions. So they should be seeking right information about their symptoms, about various treatments, about various non-pharmacological strategies which can help. So a person can help their healthcare team by providing them information about their condition, the effect of medications, taking medications on time and as instructed, and noticing the effect of medication, and if they have noticed any undesired effects, so they could then make notes, and when they see their healthcare members team, so they can discuss those points with them. So patients can involve themselves in exercise, which is very important. Doing a regular exercise at fixed time, so on daily basis, at least 3 to 5 days a week, for 30 to 45 minutes is very helpful. And there are certain special exercises for Parkinson's disease which can help patients balance and walking and gait and prevent falls. So patients should get involved in those. Furthermore, patients should also learn about more strategies for symptoms such as freezing of gait or drooling or constipation, because in addition to medication, which is the main part of treatment of Parkinson's disease, there are many other strategies which, if practiced, they can make life easier and they can improve the quality of life of patients. Another question came that what causes Parkinson's disease? Parkinson's disease is due to the degeneration of the neurons in the brain, certain parts of neurons, certain types of neurons in certain parts of the brain. Dopaminergic neurons. Dopaminergic neurons are the one which produce dopamine. So these neurons, they start dying faster than they should. So as a result, there is lack of dopamine. Since neurons generally don't divide or regenerate, so once these neurons start dying, there is a deficiency of dopamine, and because dopamine helps our movements, so the speed of movements decreases, and therefore people start feeling slower than normal, and that leads to Parkinson's disease. What causes Parkinson's disease in certain people and not in other people is not completely. We will take a break. We will take a break till next week. We'll hope to see you next week to join us again in session Sunday. And thank you very much for joining us and interesting questions. Thank you, and goodbyes from World Parkinson's Program.